Why even bother learning about chronic pain? To fight chronic pain, you need a village. Patients, families, healthcare providers, nurses, therapists can all work together to manage chronic pain. Chronic pain changes your life. Maybe you have pain sometimes, like migraines, or when you're walking, like plantar fasciitis. Maybe it's there all day, every day, like fibromyalgia or back pain. The worse your pain, the more it affects your life. Chronic pain can be like a prison. And to break out, you need to chip away at the walls of pain. We can start the journey by looking at fascia. Why fascia? Well, fascia is one piece of the puzzle of chronic pain. Because no matter what the cause of your pain, fascia will be involved in some way or another. It may not be the root cause, but treating fascia problems will ease some, if not most, of your pain. Where do you find fascia? It's everywhere. It connects you from the top of your head to the bottom of your feet. It connects you from the outside, running through your skin, to the inside, over and in muscles and organs. It's a connective tissue, connecting skin, muscles, organs, nerves, even bones to different parts of your body. A form of fascia can be seen under the skin. Take a look at this chicken leg. That slimy stuff connecting the fat and skin to muscle of a chicken leg. That's fascia. It's that white, shiny material. And it's running over the muscle, through the skin, over fat, connecting skin and muscle and fat. Fascia is wrapped around bone, tendons and muscles. But you can also see it's right in the belly of the muscle. Take a look at the white stuff in this picture. You can see the fascia running right deep into the muscle. What happens when you're injured? Fascia has to be involved in any form of trauma. It's not necessarily the cause of chronic pain, but it can add to pain from illness or injury. Like all tissue, fascia changes when it's injured. It can become as sticky as honey. It can cause tissue to stick together. Think about adhesions. They can occur after surgery, and they can cause abdominal pain. With repetitive injury, fascia changes, and it can heal poorly. Scabs over an open wound, they can become thick and hard and stuck down. Well, in that same way, fascia and muscle can stick together in clumps, causing knots. You may have heard that crunchy sound when you're moving your neck. That's your fascia groaning. Knots of muscle and fascia can cause something called trigger points. And trigger points can hurt long after other parts of your body have healed from injury. Scarred, tight fascia can cause pain. Injury can cause taut bands, even nodules that can be felt under the skin. The nodules are known as trigger points. Trigger points can actually act as a source of pain. They can cause spontaneous pain in many parts of your body. Sometimes you can feel them. You can touch these areas and you can notice pain, even tingling or numbness. And this pain or sensation of tingling and numbness can actually radiate from the area of the trigger point. It can spread out over your body, up and down and away from the source of pain. To make it even more complicated, nerves have layers of fascia. This connective tissue is layered around the nerve, and you can see it running through the bundle of the nerve. If fascia around a nerve is injured or swollen or otherwise altered by disease, it can cause nerve pain. Nerves traveling through deep fascia can be affected if the fascia is affected. Nerve pain can feel like lightning bolts or burning, even electric shocks. Take a careful look at these pictures. The areas in red show the areas where pain can actually spread out from trigger points. You can have feelings of pain, numbness, tingling. These areas can feel like a pinched nerve. Not all pain that spreads down from your neck to your arms or from your back to your legs is nerve being pinched in your back. Sometimes this pain is from a trigger point. In the same way, myofascial pain, this is pain that's coming from your fascia and muscles. This can cause headaches, neck pain, jaw pain, TMJ pain, even sinus pain. Once your doctor has excluded serious causes of pelvic pain, think about how trigger points and myofascial pain can cause pelvic pain. And pelvic pain can lead to sexual dysfunction, a terrific pain in the rectum, pain in the vagina and vulva, pain that feels like bladder pain, even prostate and testicular pain. By now you've figured out that myofascial pain and trigger points can lead to widespread pain. And widespread pain causes fatigue, poor sleep, poor concentration, which is known as brain fog, changes in mood, feelings of helplessness, anxiety, even depression. Before going forward, you need to answer the following questions. Have you been to see your healthcare provider? Have serious medical conditions been excluded? And have you been given the go-ahead to stretch and exercise by your healthcare provider? If yes, you can move to the next step. If you follow the program, you can experience certain benefits. Within a few weeks, you will notice less fatigue. You will begin to understand your pain. Your pain will still be present, but as you follow each step, you should notice improvement. If you're up for the challenge, painimprovement.com can provide you with many resources for pain management, including Pain BC and Self-Management BC resources.